started, can I get you to verify your name and your date of birth?
My name is Maddie Odom, 11/1895.
Okay, Maddie Odom, do you know what time it is?
6 something.
Okay, do you know today's date?
April 21st.
And do you know where you are?
At hospital.
Okay, and also, do you have any allergies that I should know?
Nope.
Okay, and why are you here today?
To get a head to toe check.
Okay, and you're here to get head to toe check. Do you have any cultural considerations that I should be aware of? Okay, patient is alert and oriented times 3 to time, person, place. Alright, and before we begin, so you're here for a head to toe assessment? Okay, well let's get it started then. Okay, first I'm just going to start by palpating the head. The head is normal cephalic, no masses or bulges or lesions. Now I'm just going to assess the scalp. Okay, hair is full on the scalp, appears with no lesions and no obvious signs of lice or anything like that. Okay, and I'm just going to palpate your sinuses. Have you been feeling any pain or tenderness in your sinuses? Okay, I'm just going to palpate your sinuses. Okay, no pain or tenderness reported. Okay, your eyelashes are full and they're equal bilaterally, as well as your eyebrows. They're thick and full. Okay, now I'm just going to check the patency of your nostrils, okay? Could you breathe in? Okay, other one. Okay, your nose seems to be clear, has a clear passageway, no obvious signs of infection or congestion or anything. And now I'm just going to assess your 6 cardinal fields of gaze, okay? You just follow my hand. Okay, your vision seems to be normal in your peripheral fields. And now I'm just going to assess your mouth, okay? Could you open up for me? Alright, patient appears to have good hygiene. The soft palate rises. Teeth are intact, no receding gums. Okay. And it's pretty smile. Okay, I'm just going to test your facial muscles. Could you smile for me? Could you perk your lips out? Could you stick your tongue out? Could you open your mouth? Okay, facial movement. She has good facial movement. And now I'm just going to look at the ears. Alright, ears are normal. Not too much cerumen in the ears. Less than a 10-degree angle. Okay, and just a second here. Can you hear that? Alright, patient seems to have good vision, hearing, and speech. And I can know that she has good vision and speech and hearing because I've been talking to her and she has been responding appropriately and effectively. So, now that all of that's out the way, I'm just going to assess your temporomandibular joint. Could you open your mouth for me? Okay, could you do like this? Okay, no clicks are popping. And now I'm just going to assess your eyes. Okay, pupils are equal and round. They react to light. Now, could you look at that wall back there? Now, could you look at this pen light? Okay, pupils are equal, round, and react to light. Okay, now I'm just going to palpate your lymph nodes, okay? Have you had any swollen lymph nodes or painful lymph nodes or anything? Okay, so let's begin. So I'm just going to start this. Okay, you can lean to the side for me. Lean to this side. Okay, no swollen or tender lymph nodes or anything. And now I'm just going to palpate your temporal pulses. Okay, temporal pulses are equal bilaterally in 2+ pulsations. And also I'm just going to palpate your carotid pulses. Okay, carotid pulses are equal bilaterally. Okay, 2+ pulsations. And I'm just going to check the range of motion in your neck. Could you lean side to side and around? Patient has full range of motion in the neck. Okay, trachea is midline. So let's go. Okay, no obvious masses or lesions or anything. So could you swallow for me? Okay, thyroid is not palpable, and that is a normal finding. And now, I'm just going to test your shoulder strength. Could you hump up your shoulders? Okay, muscle strength is equal bilaterally, okay? Okay, and that seems to be all. So now I'm just going to move on down the body, okay? Just going to check your skin. No obvious masses or lesions or anything. Skin is appropriate temperature and it is appropriate color for race. Now could you squeeze my hands? Alright, muscle strength is equal bilateral in the hands. Now I'm just going to assess for capillary refill. Capillary refill less than 1 second. And there's no obvious signs of clubbing your fingernail or right at or less than 160 degrees angle. And also you have good nail hygiene, no drying. Okay. And now just back to your eyes. Your sclera is white, and your conjunctiva is pink and moist. Could you open your mouth for me again? Alright, it's very pink inside there. I know that she does have good hygiene. So, now I'm just going to assess your radial pulses, okay? Okay, radial pulses are equally bilateral and 2+ pulsations. Alright, now I'm just going to palpate your legs. Your legs are, equal hair distribution, no obvious signs of masses or lesions or anything. Now I'm just going to check your capillary refill on your toes. Okay, capillary refill is less than 1 second. Could you close your eyes for me? Can you feel that? Okay. Can you feel that? Okay, tested her reflexes on the bottom of her foot. Okay, and now I'm just going to start with, let's check your Holman sign while I'm down here. Okay, I'm going to push your feet up and you let me know if you feel any pain. Okay. Negative Holman sign. And now I'm just going to get back to her heart sounds. The first thing I'm going to do is I'm going to listen for vascular sounds. But before we begin, I'm just going to palpate. Okay. There are no obvious signs, no heaves, lifts, or thrills. I'm going to do the same for the back. Okay. Scapula midline, equal bilaterally. Spine is also midline and everything. So now I'm just going to get started with your vascular sounds. I'm just going to start on your neck, okay, to make sure I don't hear any vascular sounds. And I'm going to use the bell of my stethoscope. Could you hold your breath for me? Okay, you can let it go. And on this side, could you hold your breath for me? Okay, you can let it go. No vascular sounds or bruise heard. So now I'm just going to get started with your heart sounds, okay? And I'm going to use the diaphragm of my stethoscope, okay? Okay, and now I'm going to assess the apical pulse for a full 60 seconds, okay? Okay, your heart rate is 60 beats per minute, and that's within normal range for your age. And also, your respiratory rate was 16 breaths per minute, and your breaths are equal and unlabored. So now that I'm finished listening to, I'm just going to listen to your heart sounds. For any vascular sounds, I'm going to use the bell of my stethoscope. Okay, no vascular sounds heard. Now I'm just going to listen to your lung sounds, okay? I'm going to change it back to my diaphragm. Okay, just keep on breathing steady for me. Okay, your lung sound, and I'm you draw your arms, I'm going to listen to your peripheral feels. Okay, and I'm just going to go on this side and listen to you. Okay, and I'm just going to listen to your lung sounds posteriorly. But before we do that, I'm just going to check your lung expansion. So could you take a deep breath for me? Okay, lung expansion is equal bilaterally, and I'm just going to listen for your lung sounds. I'm going to make sure that it's midline and not on the scapula. Okay, deep breath. Let it out. Okay. Deep breath. Okay, deep breath. And one more. Okay, lung sounds normal, no adventitious sounds detected. And now I'm just going to take a look. Your ribs float at a 45-degree angle, and your costal angle is less than 90 degrees. Okay, and I'm just going to say, can you hop up here so we can assess for your vowel sounds for me? Okay, and first I'm just going to check your jugular vein distension, okay? And this angle, I see a pulse, but it's not bounding, so that is a normal finding. Just check on this side. Okay, and it's the same here as well. And first I'm just going to, and now I'm just going to listen for the vowel sounds, okay? Okay, skin is paler than the other parts of her body, but that's a normal finding. And she's very thin, so there's no pulsations noted, and that's normal as well. So we're just going to start in the upper quadrant. Okay. Okay, Miss Oldham, you seem to have hyperactive vowel sounds, but I know you just got sonic not long ago, so that explains why your vowel sounds are kind of hyperactive. So now I'm just going to listen for vascular sounds, okay? Okay, no vascular sounds heard. So can you cough for me? Okay, no bulges or anything, so we know she doesn't have any hiatal hernia or anything like that. So now I'm just going to palpate, okay? Now, do you have any pain or anything? Okay, I'm just going to start by light palpation, which is 1 to 2 inches, okay? In each quadrant. Okay, and now I'm just going to do a deep palpation, which is 4 to 6 inches. Okay, no masses or bulges or anything found, so everything appears to be normal. So now, can I get you to just stand up for me? Okay, now I'm just going to check your range of motion. So can you do this? Can you do this? Okay, and this. Okay, and now can you just flip your wrist? Okay, range of motion in our arms and wrists are great. Okay, now could you just stand on one leg? Range of motion in your foot. Okay, and the other leg. Range of motion in your foot. Patient appears to have good balance. And now I'm just going to check your lumbar sign. So could you close your eyes for me? Okay, Romberg sign is negative, so that's a good finding. And now I'm just gonna ask you, could you walk here for me? Just walk. Okay, now you can turn around. And can you walk on your heel to toe? Okay, and can you walk on your heels? And your tippy toes? Okay. Patient has a balanced gait. Everything appears to be normal and everything. So let's see. Where I am. There it goes. Okay, now I'm just gonna, can you have a seat? I'm just gonna check your did I check your pulse in your foot?
I think so.
Okay, so I think I did, but it always just do it again. So I'm just gonna check your posterior tibial pulses. They're at 2+ equal bilaterally, and now I'm just gonna check your dorsalis pedis pulses. Okay, 2+ pulsations, and they are equal bilaterally. And Miss Oakland, was there anything else that you did today? Okay, you appear to be healthy and good.